Hi, I'm Deborah Ferguson Payne. I'm running for your state representative in Knox and southern Laurel counties. I am a 40-year resident of Knox County. I'm a 30-year retired teacher. I have always been behind the scenes, politically active. I have worked in several different capacities for community service. I am the current president of the Knox County Retired Teachers Association. And I keep up on political activity and what's going on in our nation and our state. I feel like we need to quit treating the drug problem as a crime. If we look at it as a crime, our horse is already out of the barn. We're too late. It's happened. It's over. We are chasing the problem. We need to get ahead of the problem. We need to start treating drug addiction as the health crisis it's become. We are losing more people to drug overdose deaths than we are car wrecks. Our drug overdose deaths increased 12% in the Commonwealth of Kentucky last year. We have to get it before it becomes an addiction. We need rehab facilities that are residential in every single county in the Commonwealth of Kentucky. We need our people to be in-house with daily drug testing, morning and evening. We need counseling that is required twice a day and any other time they feel they need it. We need job training that actually gives these people a skill that they can leave the facility with and get a job. Working with the local governments is the job. The job of the state representative is to take the concerns of the people in your district and actually discuss those concerns, come up with a plan, ideas, and a plan and legislation that will address the problems or the issues that are going on. And you can't do that unless you include the citizens in the district and any local government officials. It has to be a well-oiled machine, or it's just parts thrown in a box. Passed in Kentucky has created a poverty situation. We are now the state with the most number of minimum wage jobs. And while the unemployment rate is low, it's because so many people have to work 2 and 3 jobs just to scrape by and try to pay their bills. I would like to see technology infrastructure enacted first. We have to have the infrastructure available to businesses in order for them to locate here. We need broadband, high-speed internet across the county. We need adequate cell service across the county. We need even homes that can't afford internet need to have some type of an incentive program or some type of a cost share, so that those homes also have access to internet, and that can increase the job potential for them. You can't get a job now if you can't apply online. You can't get a job if you don't have the internet service to search for those jobs. It's essential to improving our economy that we have that infrastructure in place and it's usable to all. I think, as a former teacher, I see this. I saw so many children lose interest in the classes they were taking in high school because of the required curriculum that they didn't want to finish school. I think that we should use aptitude tests, we should use interest inventories, and we should start individualizing instruction across the curriculum in middle school. Children who are entering an art program, someone who wants to work in graphic arts or someone who wants to work in photography will use mathematics much differently than someone who wants to be an engineer. And we need to start individualizing that instruction. Children who want to go into some form of journalism require the English and language courses that we have much differently than someone who wants to be a sign language interpreter. Our curriculum, while it needs to meet basic standards for the state graduation requirements, needs to be more individualized so that our children see why they're studying each subject, how they're going to use it in their life, and it will be useful to them. I feel you should have the option. A one-payer system would cut the cost of medical care in half. Between 25 and 50% of all insurance premiums is a profit margin for the insurance company. If we had a one-payer system, the profit margin would be gone. Our one-payer system that we have right now, Medicaid, has a 3% management cost. It only costs 3% of all the money paid into the Medicare system to actually run the program. It's very, very efficient. And if the profit margin drops, so does the cost of everything that we're doing. And that doesn't mean that your healthcare providers and your healthcare facilities and your medical instrument manufacturers don't make a profit. The profit margin for them is still there. But the cost of the care received would go down. And if someone, if there's people out there that want to keep private insurance through an insurance company, that should be an option as well. I need your help. I need your vote, but I also need your input. I cannot do the job of state representative, representing you, representing your wishes, your concerns, addressing what you want done, unless you tell me what that is. I have a place for comments or an email on my website, which is debbiepayne.net. Please go online, look at those issues, leave me a comment, give me your input so that I know which issues you find most important and what I should be working on for you. I've been listening to the people who have things to say to me as I go out and canvass door to door. Grandparents, I understand your frustration with the foster care system when you can't get help for children that you're raising. Parents, I understand. I agree with your concerns for our education system. We need to work hard to be the best education system, public education. Every child has access to it. Every child can succeed. Every child's needs should be met in a public education system, and I know that. Let me know what you are most worried about so that I can address that need. Thank you. I appreciate your support. I appreciate your vote November 6th. Deborah, Ferguson, Payne.